If you work with cash pay patients and you're wondering, how do I work with pro athletes and what do I need to change in my clinical approach, this video is going to be perfect for you. My name is Dr. Garcia. I help cash-based physical therapists just like yourself improve clinical outcomes and improve patient satisfaction. When we look at what a pro athlete needs and wants, this can be daunting. This could be something you've never done before. Maybe you've worked with higher level athletes, maybe collegiate athletes, a star D1 high school athletes that are on track to go to a high level college. Pro athletes are a little different. I'm going to simplify the process and help you understand that 3 things need to be done in every session with a pro athlete, and it has nothing to do with exercises you perform. I've worked with pro athletes in pro sports for over a decade, and here's the things I can help you do. After creating 3 cash-based locations in San Diego, California, and getting to over 15 staff, I can tell you confidently that managing pro athlete is very, very simple and basic. One of the first things you have to understand is pro athlete has a lot of things going on in their life. They have their coach who's telling them how to perform better. They have a strength coach that is creating a routine for them that's probably adding more stress than they need. And they have a medical team that is trying to figure out how to keep them healthy throughout this process. They might also have a dietitian that they work with, a sports psychologist. So they have a lot of things going on in their external environment now, which creates a challenge in their internal environment. How do you fit within that realm? Now, if you're going to be a traditional insurance-based physical therapist, you're just going to try and load them with the fanciest exercises, the most amount of exercises, so that way they can perform better. And you think that your job is to help them perform at a higher level. Well, when a pro athlete has a coach, speed coach, a strength and conditioning coach, their job is really to enhance their performance. Your role is to figure out how do you reduce the stress so they can alleviate this discomfort and work within that team. So that is your role as a physical therapist. They might be in their off season. Whether they're in season or off, you still have to understand what is happening in their environment. If you go in the insurance-based model, you're going to try and be a superhero. I'm Superman. I'm going to be the reason you get back to play. So I'm going to tell you exactly what's going on. I'm going to load you with a lot of exercises, tell you to do these things 5 times a week, and you're going to blow them up. And what I mean by that is you're going to give them too many things. It's going to be too intense and it doesn't fit into their schedule. So how do we fix that? So the first thing to do is figure out what is in their entire weekly schedule and an entire quarter. And what I mean by that is if you look at how often they're practicing, how often they're in the weight room, now you can figure out where you can plug and play and include your total volume of exercises. So if they're in the weight room 4 times a week and they practice 5 times a week, how does rehab fit in that? They probably don't have a lot of time, their body's beat up, and they don't need more rehab exercises. The question is, how do you reduce stress in their week so you can understand how to remove the pain? So for instance, if somebody is training 4 times a week and they're at practice 5 times a week, your goal here is not to add more exercises. It's what can you adjust in their strength and conditioning program that maybe you can reduce and take away bench press if their shoulder is hurting, or reduce the volume and then add in between their sets, add in some rotator cuff strengthening or some scapular work or the thoracic mobility, whatever it is that you're trying to fix. How do you thread your rehab components into their workout routine while reducing their volume? The next portion is, while they're training, is there something in their conditioning sessions that you can remove and add in some rehabilitation work? So instead of doing the sprints, if they have Achilles tendonitis, can you work on single leg balance? Can you do some hip and core work while everyone does the sprints? You can lower the volume. They can sprint a couple times, but in the meantime, they're not resting. They're working on rehab. So there is an easy way to, one, look at their total weekly schedule, their total weekly volume. That's the first thing. And if you don't understand that, it becomes very difficult to really look better than any other provider that they've always worked with, because traditional insurance-based PTs don't know how to work with pro athletes, so it's intimidating, it's daunting. Figure out the weekly schedule looks like. Learn how to insert yourself within that. The next component is to figure out what is their tissue healing timeline. Are they in the acute injury phase, subacute, or chronic? That tells you how to manage this individual. If you're a traditional insurance-based PT, you've probably only seen people from a month after injury to about 4 months because of insurance limitations, meaning if someone got hurt, they probably went to urgent care. That took them 2 to 3 days. They went to their primary care. That took them up to 2 weeks. Then they got an x-ray and a referral. You probably didn't see them until at least a month out from the injury. That's just the nature of the system. So now that you work with more cash pay, they're willing to see you sooner. Now that changes. Great, what do I do now? I've never seen these people, and how do I change that? Well, you do have to understand that acute injury management is going to require more soft tissue healing. That's going to last you 72 hours up until that 4-week mark, and that's when you're going to go slower and not aggravate them So you can't apply traditional insurance-based PT, high volume, high intensity on an acute injury management. So you're going to go slower with the acute side. If they're in the subacute phase, you can start to load them a little bit more. However, you're still sensitive within that timeline, and then you can manage chronic-based PT without a problem. The timeline helps them understand what they can and can't do, and that's what you have to figure out in their weekly schedule. If they had an ankle sprain and they're now going to practice, what can and can't they do? Instead of just saying, hey, here's what you do, we need to give you some bumpers or red and green and yellow lights on what you can do in practice. You cannot sprint and you can't go multi-directional. However, we can work on marching, single leg balance, gait, all those things you now have to modify. So now that you know what their weekly schedule is, you know what their tissue healing is, now you have to control for that. The last portion you have to understand is, what is the timeline? How soon do they need to get back to sport? If they have a fresh ankle sprain and they need back to sport and they're in the acute injury phase, that means that you have to be able to get them into conditioning without flaring them up on their ankles. So you might have them on a bike or a rower or in the pool in the background during that phase. Now, if they're in their off season and they have months to do, there's no reason to compact everything into a small time phase. If you want to work with more pro athletes or looking to figure out, you have to understand these three variables. You can add in all the Therex that you want, all the corrective exercise you want, but if you don't understand these three things, you don't know when to include them, and that's the problem. So if you want to make a difference in a cash-based setting so you can see more pro athletes, understand their weekly schedule, understand their tissue healing guideline, and then lastly, understand their timeline to return to sport. Those three things will make you a rock star and a clinical expert in your town. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.